coming off antidepressants. So a lot of our patients come to us, they've been on an antidepressant for a few years, and they want to know, can I come off, and how are we going to go about doing that? So the thing is, we want you to tell your doctor. It shouldn't be a secret. The prescribing doctor, they're the one who gave it to you. They should know that you want to come off of it, and either they're supportive or they're not, depending on your particular situation. But you've done your due diligence, you've told them, and then working with another professional, such as one of us, to help wean off slowly. We want to go slowly. That's the big thing. It's so 10% decrease every week or more. This is a longer period project. And then we also want to make sure your replacements are in place. So when you're going off, we have some other things that are there so that if the rug is pulled out from underneath of you again, you have that big stressor again, you have your supports ready.
Yeah. And I mean, with the herbal supplements, there's so many things, and they all affect different neurotransmitters. 5-HTP is quite specific for serotonin. Passion flower affects GABA. They all do their thing, and so if we get to that root of it, we can play with them a little bit more in appropriate dosages for you. Yeah, it's pretty amazing. This is what can happen when you just stop. It's not nice. There have been people who have been trapped in their house for a couple days on the floor, seriously thinking that they might kill themselves. It's not a good idea. Even if the side effects are unbearable, please don't just stop taking them. If you know anybody who's talking about, just don't stop. Just don't just stop. None of this is good. None of this is good. And it can last. It can be horrible. How are you going to know if you're ready to come off antidepressants? This is a big conversation Whitney and I have with patients, because they come in and they go, okay, I'm ready, let's go. And we go, okay, well, so what circumstances were in your life when you went on the antidepressants? And they talk about the stressful job they have. Okay, so what's different at work? Nothing. Okay, that's probably a good indication that maybe now's not the best time. Things have to shift, they have to be different. Otherwise, you're putting yourself in exactly the same position. So you want to make sure that things are more stable. Your depression has to be stable for a good 6 months. If you're still on the roller coaster ride of days being all over the map, it's probably not a good time to play with the meds in terms of decreasing them, unless the side effects are wicked. Then maybe we do need to look at that. But generally speaking, we want a good 6 months to see that you're good, that you have been stable. That would indicate to us that you've probably done some of the work that needs to happen for you to safely come off of them. And that would be the next bullet point. Making sure things are incorporated already. You've started working with your blood sugar diet. You've started your exercise program, and that's part of what you do every day. You roll out of bed, you get on a bike, or you go for a walk, or you go to the gym, or you do whatever. It's just part of what you do, and it has been for months. You're probably going to keep it up. Whereas if you're just taking something up now, it may not hold. Like Whitney said, when the rug gets pulled out of you, exercise is very often the first thing that falls off people's plates. Your support team being established, this is huge. This is huge. Who are you going to talk to then? When that rug happens, are you going to, having a relationship with a counselor or a psychologist or whoever you're comfortable with long before. So you've got 6 months of seeing them. Maybe you're seeing them every month or two. But then when stuff happens, you know where to go. You don't have to go through your whole history. You just walk in and go, "Wah!" And they know exactly where you're starting from. So that it's huge having that. And we are that for some people. I mean, they come into our office, they sit down, and they burst into tears, and we talk through what's going on and make the adjustments as necessary. And we have a wonderful group of counselors and psychologists that we refer out to, because there's some really amazing people in town. And if you've seen one and you didn't like them, try another one. There are lots to choose from.
Yeah, you have to have that personal connection, for sure.